Okay, my name is Allie Johnson, and it is October 29th. This is Ida, and this is my trunk palpation video. So, the rectus abdominis originates on the pubic symphysis and inserts on ribs 5 through 7 and the sternum. It does trunk flexion. The internal oblique originates on the anterior iliac crest and thoracolumbar fascia. It inserts on ribs 9 through 12 and the linea alba. It does trunk flexion, lateral flexion, and rotation. The external oblique originates on ribs 5 through 12, inserts on the iliac crest, linea alba, and pubic symphysis. Its primary movements are trunk flexion, lateral flexion, and rotation. The transverse abdominis originates on the inner aspect of the last 6 ribs and the lineal aspect of the iliac crest and the inguinal ligament. It inserts on the outer edge of the middle 1/2 iliac crest, and it stabilizes the vertebral column, increases intra-abdominal pressure when contracted. The quadratus lumborum originates on the iliac crest, inserts on the 12th rib, lumbar 1 through lumbar 4 transverse processes. It does hip elevation, trunk extension, and trunk lateral flexion. The erector spinae muscle groups. The first muscle lateral to the spine is the spinalis, the longissimus, and the most lateral to the longissimus is the iliocostalis that does trunk extension. The anterior longitudinal ligament runs down the anterior surface of the spine on the vertebrae bodies and prevents hyperextension. The posterior longitudinal ligament runs down the posterior surface of the spine on the vertebrae bodies. It supports posterior aspects of the anterior vertebral column. The ligamentum flavum connects to the laminae on the posterior aspect of the foramen. This fuses with the facet joint capsules, and the function is to maintain upright posture. It connects from the C2 to S1. The supraspinous ligament is strong, fibrous cord. It connects from the spinous process of cervical vertebrae 7 to lumbar 4. Maintains upright posture of the head. The invertebral disc serves as spacers to help separate the vertebrae and allows for roots to pass through other structures of the body. It lies between the adjacent vertebrae in the vertebral column. The linea alba is a place where muscles attach to the transverse abdominis and the internal oblique. It separates from the left and right abdominis muscles. The pubic symphysis is between the left and right pubic bone, near the midline of the body and superior of the bladder. It is a fibrocartilaginous disc and does not allow much movement. This resists tensile and compressive forces. The thoracolumbar fascia is a place of muscle attachment. It prevents the spine from going into too much flexion and extends from the nuchal ligament and the vertebrae to the sacrum. To palpate skeletal structures, I will find the cervical vertebrae 7 by flexing the head and finding the most prominent bump. Once I have found cervical's vertebrae 7, I can palpate inferior to that, which is thoracic vertebrae 1, the beginning of the thoracic spine. Just inferior to that is the spinous process of thoracic vertebrae 2. The thoracic vertebrae 7, you find the 7th and 8th pair of ribs, and it is inferior to the scapula. And inferior to that is T8, T9, T10, T11, and T12. To find thoracic vertebrae 12, find the horizontal and spinous process of the 12th rib. The lumbar vertebrae 4, you place your thumbs on the superior border of the iliac crest and bring the tips of my thumbs together, and that will be on top of lumbar 4 of the spinous process. Once I've palpated lumbar 4, I'll go superiorly to feel lumbar 3, lumbar 2, and lumbar 1. If I go inferiorly to lumbar 4, I'll palpate lumbar 5. To find sacral vertebrae 2, you find the level to the inferior portion of the posterior superior iliac spine. Here, the sacrum, you find the back dimples on top of the buttocks, and the sacrum, it sits in between here. The first 7 ribs attach to the sternum, and the lower 5 ribs do not attach to the sternum. 8, 9, and 10 are attached to each other by costal cartilage. Ribs 11 and 12 are known as floating ribs, and they allow for chest expansion. The sternum and the sternal notch is this dip right here. The manubrium is the inferior to that sternal notch. The body and the xiphoid process of the sternum is where the lower ribs attach, so up here. The ilium, the iliac crest, which is this arched bony part that sticks out here. The anterior superior iliac spine is in front here, and the posterior superior iliac spine. Then we have the facet joints, which are small cartilage where each individual vertebrae meet the one above and below. It does lumbar stability and forward flexion. It moves about the frontal, sagittal, and transverse plane and along the frontal, horizontal, and vertical axis. It's a synovial joint that allows flexion, extension, and twisting. The sacroiliac joint, you feel for the posterior superior iliac spine of the ilium and move inferiorly to the sacral tubercle towards the pelvic bone. This is a synovial joint plane and supports the spine and rotates and translates along 3 axes: the frontal, sagittal, and transverse plane. It moves about the frontal axis, horizontal axis, and vertical axis. And that is my trunk palpation video.